Assalamu alaikum warahmatullahi wabarakatuh. To carry on with the upper limb lectures, I'm gonna cover in this presentation some of the muscles of the upper limb. I'm Dr. Dalia Saleh, professor and the head of anatomy department at Mansoura University, Egypt. The objectives of my presentation will be about the muscles that hold the upper limb to the axial skeleton. I'm gonna focus on the following: the trapezius muscle, the latissimus dorsi, the levator scapulae, the rhomboides minor and rhomboides major muscles, and also the serratus anterior muscle. For the muscles of the back, we have the superficial and middle layers. They take origin from the axial skeleton and inserts into the bones of either the pectoral girdle or the humerus. In the superficial layer, we have the trapezius muscle and latissimus dorsi. Underneath these two muscles, we have the middle layer, which is formed of the levator scapulae muscle, the rhomboides minor and rhomboides major muscles. As I said, they originate from the axial skeleton and inserts into the upper limb bones. Let's start first with the trapezius muscle. The trapezius muscle is trapezoid in shape. It takes origin from the skull at the external occipital protuberance, from the ligamentum nuchae, which is attached to the spines of the cervical vertebrae, then from the spines of the vertebrae from C7 up to T12. It is divided into upper fibers, middle fibers, and lower fibers to be inserted into the following areas: at the lateral third of the posterior border of the clavicle, to the medial border of the acromial process, and the upper border of the spine of the scapula. For the actions of the trapezius muscle, this muscle will act both on the shoulders and also on the head. So for the shoulders, if you remember, I said it has upper fibers, middle fibers, and lower fibers. The upper fibers of the trapezius will elevate the shoulder as in shrugging, while the lower fibers will depress it or return it to its resting position, while the middle fibers will retract the shoulder. If the upper fibers and lower fibers work together, they will rotate the scapula, as in raising the arm above the level of the head. The trapezius also acts on the head, causing its extension backward. For the nerve supply of the trapezius, it is supplied by the spinal accessory nerve or the 11th cranial nerve. Next, we will talk about the latissimus dorsi muscle, and as you can see here, it is a very wide muscle, hence its name. The latissimus dorsi muscle is broad and wide. It takes its origin from the spines of the lower 6 thoracic vertebrae and then moves downward and takes origin from the thoracolumbar fascia and then from the iliac crest, while its upper border, during its winding around the thoracic wall, it's also attached to the back of the inferior angle of the scapula. Its lower fibers, while going upward towards its insertion, is also attached to the lower 3 or 4 ribs. Then it is inserted into the bicipital groove of the humerus. For the actions of the latissimus dorsi, it adducts and extends and medially rotates the arm as if you are folding your hands behind your back. Also, if the insertion is fixed, so if you are fixing your arm, you can drag your body upwards towards the insertion, as in climbing, swimming, and forced expiration. It takes its nerve supply from the thoracodorsal nerve or nerve 2 latissimus dorsi, one of the branches of the posterior cord of the brachial plexus. Now we move to the middle layer. If you remember, we have 3 muscles here: the levator scapulae, the rhomboides minor, and rhomboides major. The origin of these muscles for the levator scapulae from the transverse process of the upper four cervical vertebrae, while the rhomboides minor from the spines of C7 and T1, and also from the ligamentum nuchae. Below it lies the origin of the rhomboides major muscle from the spines of the second to the fifth thoracic vertebrae, and also from the supraspinous ligament. For their insertion, the levator scapulae is inserted into the superior angle of the scapula, while the rhomboides minor at the medial border or vertebral border of the scapula, opposite its spine, while rhomboides major also into the medial border of the scapula but below the level of the spine. For their nerve supply, the levator scapulae is supplied by the third and fourth cervical nerves, while rhomboides minor and major muscles take their nerve supply from the dorsal scapular nerve from C5, which is one of the branches of the roots of the brachial plexus. For their action, the levator scapulae and the rhomboides minor and major elevate and retract the scapula. So in this action, you approximate your shoulder blades together. Now we will talk about the serratus anterior muscle. It lies, as you can see here, on the side of the chest. The origin of the serratus anterior from the lateral surfaces of the upper 8 or 9 ribs, and because of this origin, it has a tooth-shaped origin. That's why it's called serratus. It is inserted into the costal surface or the anterior surface of the medial border of the scapula. It takes its nerve supply from the long thoracic nerve or nerve 2 serratus anterior. It originates from the 5th, 6th, and 7th cervical roots of the brachial plexus. The action of the serratus anterior is to protract and rotate the scapula. So together with the trapezius, it helps to raise the arm above the level of the head. It also keeps the medial border of the scapula opposite the chest wall. So if there is injury of the long thoracic nerve, for example in the axilla surgery or whatever, this may lead to paralysis of the serratus anterior and loss of its function and winging of the scapula when the patient is trying to push against a wall. This is the end of my presentation. Thanks for listening. If you like it, please do not forget to subscribe, like, and share. And do not forget to hit the notification bell so you can know if I upload another video.